Well, they put me in a very tough situation. How many of you are here thinking you're going to hear about laughter in medicine? Yeah. That's why I'm here too. I came to hear about laughter in medicine only to find out that I'm the replacement for the laughter in medicine guy. So anyway, I'm from Hawaii. I'm chair of the International Holistic Therapy Association. And I actually do use laughter in medicine, so I'm going to say something about that. I have the timer hasn't started yet, so. I have a small concept. I started the integrative medicine program at the medical school, and I have a small concierge medicine practice, and I do use laughter as medicine. I once a week, every Monday, because the news around the world has been so somber that every Monday I send out a message, laughter is the best medicine, and I send out a joke of the week. Would you like to hear my joke of the week?
Sure. Yeah.
So one thing I've known after many years of practice, there are three kinds of people: those who can count and those who can't. And the people who aren't laughing are the ones who can't count. All right. So let me start with the stories, because I don't think anyone else here is from Hawaii, but I was born and raised in Hawaii. I was born in 1951, the year my father got cancer. And back in 1951, there was nothing they had for cancer except to cut it out. They sliced him open, took out the left side of his colon, left him with a permanent colostomy, and said, good luck. And in those days, I can't remember anyone surviving cancer, because back then they really had nothing much for them. And I asked my mom, said, can't they cure cancer? Can't they cure Dad's cancer? And she said, no, we just have to pray about it. And I did pray, and that's one of the reasons I believe in the power of prayer, because my dad survived the cancer, one of the few people back in those days who did survive. But throughout my life, growing up with a dad who had a colostomy, we never knew how long he was going to live. We were always worried that the cancer would come back and Dad would be gone. And in the back of my head that whole time, I was thinking, how come we can send a man to the moon, we can blow up cities, but we can't cure cancer? So that's one of the reasons why holistic alternative medicine was always on my mind. Now, my history is a little complicated. I'll make the long story short. When I found out how long it took to become a doctor, I didn't think I had the patience for it. And I don't mean patience, but I mean I didn't have the stamina for it. So I went to law school first, and I got fed up with the way law was practiced. So I realized, well, maybe I should just go ahead and spend all the years and be a doctor. And I went to medical school, and I got fed up with the way medicine was practiced. Because this is my experience in med school. In med school, we have physicians in the room. There are a few, yeah. So you'll know what I mean. By fourth year, you have preceptorships. You work one-on-one with a doctor, and my preceptor, I'm sitting there in a clinic, and my patient has diabetes, hypertension, cholesterol problems. And so my preceptor leaves the room. Actually, he tells me, okay, prescribe this medication. And so I do that. And he leaves the room. I learn how to counsel the patient about taking his medication. You take this one in the morning, you take this one with food, and I think you've all understand how prescriptions are done. And the patient asked me a very fair question. He says, Doc, when will these medicines cure me? How many of you say that's a fair question? Right? Right? You come to the doctor to be cured. How many of you know the answer? Yeah, well, the answer is never. And it dawned on me, because I went into doctors. How many of you went to medical school to be a healer? All of you, right? Did I heal that patient? Answer, no. Because by definition, if he has to take the medicine the rest of his life, he's still sick. So I'm not a healer. I'm just a dispenser of medication. I mean, I make the diagnosis, etc., and those things are important, but I wasn't learning what I went to medical school to learn, and that was how to heal people. Not just put them on medicine, but how to get them off medication. So, actually, after medical school, and you see, this is my thinking, because I was already a lawyer. I'm licensed, still licensed to practice law. But I'm sitting there. I was already a lawyer. I went to law school first. So I was already a lawyer, sitting with my preceptor, and I'm thinking, this is a nutrition disease, isn't it? How many of you would say diabetes is a nutrition disease? How many of you know how much nutrition education we got in medical school? Practically nothing. And I was a lawyer, and I started getting very scared. I said, isn't this malpractice? Right? Treating a nutrition disease and knowing nothing about nutrition. So I actually went to nutrition school after medical school so that I wouldn't get this feeling that I was committing malpractice. So I'm going to show a video. When I finished medical school, I came back to Hawaii, and I wanted to serve the most needy population. And how many of you know that Native Hawaiians have very bad health? Yeah, they actually, if you look at the statistics, they have about the worst health in the nation. I'll show you some slides about that in just a bit. And so I came back, and with my knowledge of nutrition, I created a nutrition program. And we took the people with the worst statistics, we had the best results, and I published the study. NIH heard about it, and we won a national award for our work. So I'm going to show you a video. We actually appeared on all the major networks, but I'm going to show you a video of CBS this morning about my practice. Sorry, not yet, Manny. I want you to notice the failure of the modern medicine system, because my patient, you'll see, was treated with lots of medication, and you'll see what I mean. Okay, play this.
It is 17 until the hour. A major health survey has named Hawaiians as the healthiest people in the country. But Dr. Bob Arnott, who is just in Hawaii and is now back in New York, tells us that's not true for everyone who lives here. Good morning, Bob. Good morning, Harry. Hawaii does score number 1 on the nation's Good Health Report card, with the longest life expectancy and the second best infant mortality rate. But hidden in those statistics are the Native Hawaiians, who make up the unhealthiest group in the entire nation. In fact, Native Hawaiians have the worst health of any ethnic group in the U.S. The death rate from heart disease is 3 times higher.
The foods that we eat today are very, very different from the foods that our ancestors ate. And that brought about some of the investigations.
The investigation began with Ed Aikala. At one point, the 50-year-old Hawaiian weighed 425 pounds, had a blood sugar level of 800, had severe chest pain, and almost died from kidney failure.
I overindulged in fat food, people, so ignorance is not a dirty word. It just simply means you don't know. And I was ignorant to a lot of things that concern nutrition value in foods.
I want you to show me what a typical 3-month batch of prescriptions look like for you. Hey! 3 months worth of prescriptions? How did you ever remember to take all that stuff?
sometimes I ended up in the emergency room for overdosing myself.
Ed's health is miraculously better. He's lost hundreds of pounds. His blood sugar, blood pressure, and cholesterol are all near normal. But his good health didn't come from a bottle. It came from a return to a traditional diet.
We demonstrated that eating this food will not only prevent many of their problems, but will actually reverse high blood pressure, high cholesterol. We've gotten people off of insulin who've been on insulin for much of their life.
The diet has saved Ed Aikala's life. He's totally off insulin. He's only taking 2 medicines out of that great big bag you saw, and what's more, he can eat all he wants. Ed's become a convert, encouraging other Hawaiians to drop the high-fat American diet and return to their roots. And he's made another convert, me. I'm off junk food forever. Harry?
All right, so you saw what happened. You see, when he came to see me, what had happened to him was something that does happen to diabetics. He was a truck driver. This fellow is a former Navy SEAL, but he had gone up to 500 pounds. And then when I got him, they had gotten him down to 425. But he was a truck driver. And he said one day he came home and his sock was wet. And he didn't remember walking in a puddle. And when he took his shoe off, there was a nail in the shoe, and there was blood all the way soaked through his sock. And the nail had ground a hole all the way to the bone. And when there was gangrene setting in later on, and they had to amputate his toe. But he was so scared that when they sent him to me, I suggested for him to change his diet. He was willing to do it, and this is the result. Now, what I wanted you to see about that is that giant bag of medicine. You see, what happened was he was in borderline kidney failure, heart failure, his blood sugar was way out of control. He was septic. They sent him home, a whole bunch of medicines, and he passes out at home. Send him back to the hospital, change his medicine, send him home, almost passes out again. Happened about 5 times in that 3-month period. But you know what the ironic thing was? It wasn't his disease putting him back in a hospital. What was putting him in a hospital? Over-medication. So this is an example of the failure of our, actually I call it a disease care system. I think yesterday somebody called it sick care system, same idea. All right, so anyway, so I'm going to talk about reversing disease in 10 days because I compacted this program into a 10-day program that I'm trying to operationalize. These are my affiliations, conflicts of interest. I founded the University Integrative Medicine program. I'm chair of the International Holistic Therapy Association, president of Hawaii Health Foundation. I'm with the Gandhi International Institute of Peace, and I'm with the Elders Council of Hawaiian Healers. And disclaimer, always check with your physician before doing anything mentioned here. FDA has not evaluated anything we say. So the Dalai Lama says we have bigger houses, smaller families, more conveniences, less time. We have more knowledge, less wisdom, more experts, but still more problems, and more medicines, but less health. How many agree with that one? And that's part of the problem of our healthcare system. We have a silent epidemic. Obesity increased 18% in 10 years. Yesterday, the figures showed that 42% of us are obese, 73% of us are overweight, 1 in 2 have high blood sugar, Alzheimer's disease increased 100% in the last 15 years, 1 in 5 have chronic pain, 1 in 12 have autoimmune disease, and chronic disease is rising. And you know this is going to drive our medical system broke at some point. This is obesity, but and these are, I'm just trying to back up. 1 in 2.5 people get cancer nowadays. It's a crazy number. And half of US has high blood pressure. 12.3 have frank outright diabetes. 37% have prediabetes. And you know, all these risk factors increase your death rate from COVID if you catch it. So these are the 10 leading causes of death in America. And you'll notice I have here in red, these are all nutrition-related diseases. That's one of the reasons why I studied nutrition so carefully. If you add this up, over 70% of us die of a nutrition-related problem. If 70% of us die of nutrition problems, don't you think at least 70% of the doctors ought to be trained in nutrition? How many agree with that? And we already said they don't do it. So that's another problem we have with our system. And our system is failing dismally. United States has the most expensive healthcare system, and among all these developed nations, we have the worst outcomes. We have the shortest lifespan. Something is terribly wrong with our medical system. The old paradigm is disease-centered, therefore we treat disease with disease-specific medication. The problem is, that means we don't have a healthcare system, we have a disease care system. Why do I say that? How much money is putting into keeping you healthy? How much of your insurance and medical dollars put into keeping you healthy? Practically nothing. If I counsel my patient how to get off their medication, they don't pay. They only pay for me to put them on the medication. So our old paradigm is we're chemical beings, so we treat with chemicals. The new paradigm is look at the causes, because, you know, the root causes of disease, if you have bad diet, poor exercise, the outcome is all these diseases. Good diet, good exercise, good lifestyle, you have good health. The old paradigm is focused here, focusing on the diseases, and therefore they just treat the disease. The problem is when you treat just the disease, you still have the disease. Our approach, the new paradigm, is to treat the root causes. I don't see my pointer here, but anyway, you see the green circle. You treat the root causes, and then you have good health outcomes, then you don't need the medication. You don't have the disease. So the new paradigm is we are physical, mental, emotional, spiritual, energy beings. The new paradigm is make the diagnosis, find the cause of the disease, fix the cause of the disease first, use medication only when necessary, and optimize health so that the disease never returns. That's the paradigm that I use in my integrative medicine practice. So I wanted you to see the mortality rates of Hawaiians. You can see they're more than double the rate of heart disease, cancer, stroke, diabetes. And this is why this is why we won the award, and we've been featured on all the major networks. And you just saw one of the clips. So I'm going to just go briefly over some of the main comorbidities or illnesses that we're dealing with. Of course, obesity is important. I got this gentleman to lose about 200 pounds over time. He's pure Hawaiian. But I did it by having him eat actually more food. This is more food. This is typical American food. But you will see that this is more calories than this. And I think eating more food is a better way to lose weight than to eat less food, because if you eat less food, you remain hungry and you can't stay on the diet. In our program, we published this result. Food intake increased. This thing is, my pointer's not really working. Food in grams increased, and yet calories decreased. This lady lost 56 pounds, kept it off for several years, actually many years. Controlling blood sugar and diabetes with less medication. I'll tell you the really ironic thing about our program. How many of you have heard that you should eat less carbs because carbs cause diabetes, right? This program is a very high carb diet, 75% carbohydrate, and yet diabetes was placed under control. This is Japan, high carb diet, low diabetes. This is Hawaii. They eat less carbs, more diabetes. Washington State, less carb, more diabetes. What in the world is going on here? I'm going to tell you what's happening is the education. I actually wrote a book about carbohydrates. I've written 16 books, and one of them is The Carbohydrate Revolution. People, including medical doctors, do not understand the difference between carbohydrates because carbohydrates are not all the same. If you look at this, and everybody says eat your complex carbs on the right side. Complex carbs include white bread. Look at the glycemic number, it's 100. On the left is simple carbs, that's sugar. This is table sugar, 93. How many of you ever thought that white bread was worse for blood sugar than table sugar? This is the truth. What shocks people even more is that whole wheat bread is also worse than table sugar. But see, how many of you did not know this before? Okay, you see most of you, right? You see the failure in our education? I mean, we're health professionals, most of us here, and we don't know this. And so our approach is we use carbohydrates that have a lower glycemic number, and we get blood sugar under control with a high carb diet in the same way it is in Japan. High carb, low diabetes. And other countries, by the way. This lady, I'm going to show you a video of this lady. We took her off insulin in less than 10 days. I'll show you a video at the end. This is my 10-day group. This is their beginning blood sugar. At the end, this is end of 10 days. Their blood sugars are all lower. I don't know why it doesn't quite show. The few numbers that bounce up are because we had to stop their medication because it was getting too dangerous. By the way, when we're managing diabetes, it's more dangerous to let them go too low because they might pass out. If they run too high, they actually don't feel anything. It's only dangerous in the long run. So, and then we control cholesterol, and we do all of these things to control cholesterol. I don't have time to go over all of them, but we do have protocol for lower cholesterol. This guy lowered his cholesterol by 100 points in 30 days. If you can lower your cholesterol 100 points in 30 days, why would you take statins, right? Why wouldn't you try this first? Because you know there's side effects of statins, right? Do you all know the side effects of statins? One of them is liver damage. One of them is muscle weakness and damage. And you know what's another one that's a little scary? Memory loss. You know, how many of you want to get memory loss if you had a choice? Of course not. This is a 10-day, these are the beginning numbers for my 10-day program. 10 days later, all of their numbers are lower. And some of the numbers are substantially lower. Each of those bars is 50 points. You can see a couple of them have lost 50 points of cholesterol in 10 days or more. Same thing with hypertension. And by the way, one of the best ways to control hypertension is to eat greens because they produce nitric oxide, which relaxes the blood vessels, okay? So I get all of my patients who have high blood pressure to eat lots of greens and get their nitric oxide levels up. This lady, her we dropped her systolic pressure by 70 points in 10 days. This is a group. You can see this person dropped from like over 190 all the way down into the normal range, under 130. So I'm going to play, I'm going to play this video at the end. This is a video of my program. And actually, Manny, I guess this is the time to play. So this is, I compressed the program to 10 days because some people have trouble spending 30 days. So I actually published papers. So, so this is a example of my program. Go ahead.
How soon after you began the Hawaiian diet did you stop taking insulin altogether?
It was my second week on the diet.
You're kidding.
No, it was
2 weeks out.
2 weeks on the diet.
We've done that with even worse cases with people who had even more insulin.
Dr. Shintani published the results of his diet in the respected American Journal of Clinical Nutrition. In his study, the average dieter lost 17 pounds. Cholesterol counts dropped 14%. Blood pressure and blood sugar improved as well.
All right, so actually this was a video of my patient who I took her off of 80 units of insulin in 10 days. And the reason, there's actually a Newsweek article about it way back when we did it. The reason I'm in there is that Dr. Bob Arnott is a diabetes researcher, and he thought it was impossible until I showed him my numbers. And the thing is, I didn't have only one. I had many patients that were like that. Okay, Manny, can we play the third video?
We're addicted to drugs, and I mean prescription drugs. And I mean, it's like how damaging being addicted to a narcotic is to an individual. This nation being addicted to prescription drugs is wrecking the nation.
I eat tons like to 1,800 milligrams of nutrients. I ask for alternatives to pills, and every time I go in, I get another pill. Have it? To prove I'm going to have to be taking it forever. My doctor said I'm pre-diabetic. I would get migraines every single day. Not a lower back. I had night sweats. You get that, man. There's got to be something better than this.
Have diabetes and all those things that kill Hawaiian. Really is going to be my last effort here.
There are many people taking a lot of medicines that they could get rid of if they were following a good diet and lifestyle the way we recommend. Some people say, well, your diet is dangerous. The diet makes people well so fast that their medication becomes dangerous. Yes. Actually, you should probably skip it. It's so surprising. I can't believe it. Being that it's on the low side of normal, you probably don't need your diabetes medicine.
I've already lost 11 pounds.
So that means you lost over. your blood sugar was borderline, actually slightly high, 107. No, it's 90.
I had such a problem with reflux. Practically from the first day, it's been better. I have an unopened box of Primusec.
Cholesterol was 228. And after 21 days, it's 141.
Wow! Yes!
Pains.
Ankle, knees, hips.
Okay,
And since I've been off the dairy and off the meat products, nothing.
your headaches? Okay.
I don't have any more headaches.
Right, thank you. Thank you very much. All right, Mandy, could you put up the last slide? So I think I'm out of time, but I want to thank you for allowing me to share this with you. It's a new paradigm of medicine. It's a new way to practice medicine. I think if we practiced medicine this way, we'd save a whole bunch of money. We'd save a whole bunch of lives. And right now with our disease-based system, there's no prayer of us creating a universal healthcare system. But if we do this, focus on this, reduce the need for medication, then we have a chance of creating a healthcare system that's not only affordable, but even more effective. And I want to thank you. If you want more information, I actually have at peacediet.org, you can get my book, but I give you there's a free I have a free ebook. If you go there, you get a free ebook called How to Lose Weight While You Sleep. And if you have questions, there's my email address. I want to thank you for this time. I bid you all aloha and mahalo. Thank you very much.